Hey everyone, today we are going to discuss regarding right heart failure. What is right heart failure? What are the common causes of that? What is the pathogenesis of right heart failure? And what are the signs and symptoms and how to manage the right heart failure? So please stay tuned and we are going to have lots of learning, and please jot down the important points. So right heart failure is most commonly due to left heart failure, because of left heart failure there is a accumulation of the blood in the left atrium, which puts a back pressure on the pulmonary circulation, so there is increased afterload. So right heart has to push the blood to the pulmonary circulation with resistance. It could be due to increased preload due to tricuspid valve regurgitation. There could be some abnormal substance deposition, right ventricular hypertrophy. There could be some kind of infarction, myocardial infarction, though rarely it affects the right ventricle, but that could be also one of the causes. So these are the important causes what we learned. And now coming to the pathophysiology, what happens. So what happens in right heart failure? If right heart is not able to pump, so there is a backward failure, so we call it as backward failure. So the entire body from inferior vena cava and superior vena cava, it pumps the blood into the right atrium, which ultimately gets drained into the right ventricle. So what will happen? There will be a congestion of the systemic circulation. So systemic circulation will be quite congested. There will be hepatomegaly, tender hepatomegaly will be there, and there will be congestion with alternate pale areas, that is called as congestive hepatomegaly, or nutmeg liver, properly we call it as nutmeg liver, and because of the texture appears like that of nutmeg fruit's shell. And apart from that, there will be GI distress, anorexia will be there, GI congestion is there, and there is edema that is very prominent. Here it is generally dependent edema with pitting edema is seen. Ascites may be a prominent feature, and apart from that there may be pleural effusion as well. So here there may be, because it is commonly due to left heart failure, so there may be signs and symptoms of both right and left failure may be there in these patients. And also there will be lots of signs. There will be jugular venous distension from the superior vena cava it should receive, so that it is not receiving because of the congestion. Superior vena cava will be congested, so there will be jugular venous distension. All the head and neck veins will be congested, and so these are JVP will be raised, central venous pressure, peripheral venous pressure will be raised. So these are the signs and symptoms we already learned. So an abnormal heart sound, S3 heart sound may be heard, and even a tricuspid regurgitation may be a sequence of right heart failure as well. So these are the important signs and symptoms that we learned for right heart failure. Now how to manage that? So most commonly it is due to left heart failure, and there are many other causes as well which we listed. So treatment is management of underlying cause, and apart from that symptomatic management has to be given for right heart failure patients. So that's all what we learned in right heart failure. Let's have a quick recap of everything. Right heart failure, most common causes left heart failure, and it could be right ventricular infarction, tricuspid regurgitation may be the causes. Prominent features: hepatomegaly, congestive hepatomegaly, nutmeg liver, GI distress, and pitting edema. These are the most important features. Where increased JVP will be seen, abnormal S3 heart sound is seen, and here you may need to treat the patient with management of the underlying cause and symptomatic management. Thank you for watching the video. Please subscribe to the channel, hit the bell icon, and follow in our different groups, and please stay tuned for the next video. See you in the next video. Thank you.